Welcome to The Backstory with Dr. Ricky Singh. This podcast is focused on bringing you the latest research-based information about dramatically improving health, well-being, and quality of life. And here's your host, Dr. Ricky Singh.
Today, we're going to kind of take a departure speaking about adult medicine and speak on kids and children. And one of the big topics is returning to school and how desperately we want to keep them safe when they do go back to school. You know, as the Delta variant is raging on and vaccination rates still remain low in many parts of the United States, luckily here in New York City, we're doing a relatively good job in vaccinating. You know, there's been one pressing question: how do I send my child back to school safely during the pandemic? And while much of the conversation lately has been on booster shots and breakthrough infections, and obviously this Delta variant that we're going to talk about, a lot of the parents are frustrated with the lack of advice for families, particularly those children under 12. I'm a parent. I have a 2-year-old and a 5-year-old, so I want to be safe and make myself feel good for sending my child back to school. And many of these kids aren't eligible for the COVID vaccine. So I'm here with the expert to give you guys, the audience, the most up-to-date, relevant information to make the best decisions for your family and for those around you. So my guest today graduated summa cum laude from City College of New York and received her medical degree from New York University School of Medicine. She completed her pediatric internship and residency at NYU. And prior to joining us here at Weill Cornell, and we're so very, very lucky that she did join our faculty, she worked at the Charles B. Wang Community Health Center here in New York City for 13 years as a senior pediatrician and co-director of the Pediatric Special Needs Program. And in addition to a very, very busy clinical practice, she was instrumental in the creation and leadership of a support program for parents of children with special healthcare needs. So we're very, very lucky to have my guest on the show today. So please welcome Dr. Sherry Wong to The Backstory. Dr. Wong, welcome.
Well, thank you so much, Dr. Singh, to invite me to discuss this very timely and important topic.
You know, it's inevitable. Like I said, I have a 2-year-old and a 5-year-old, and kids are going to mix, whether they're going to go to school or whether they're hanging out with their grandparents, or for us, whether they're just playing at the park. And when kids do mix, germs are going to spread. So what are some of the precautions we still need to take? You know, these risk mitigation strategies that we harp down for the adults, social distancing, hand washing, wearing a mask, are these still important in this pediatric population?
Definitely. So it's so tempting after so many months to let down our guard, but I would like to encourage all of us to get back to basics and to remain vigilant. So at last count, almost 4.3 million children in the United States have been infected by SARS-CoV-2. For our purposes, we'll call it COVID-19, a little bit easier. And in the last several weeks, the Delta variant has been the predominant strain, and the numbers of infected children are increasing actually quite quickly. So given that, the very first step that I would say should be taken to keep our children safe is, and really the most important step I think that will get us out of this pandemic, is for any adult and child over age 12 who is eligible for the COVID-19 vaccine to get vaccinated. And this way, younger children will be surrounded by protected adults and adolescents in their homes, in their schools, and in the community. And then yes, these same risk mitigation strategies that you just mentioned, including social distancing, mask wearing, and hand washing, are so important for the safety of our children, especially when they start school. In addition to these, I would add indoor ventilation and also having a regular testing and isolation and quarantine protocols. I think that's really important to make sure the school has them.
You know, a lot of us hear someone around us, someone in the family who has gotten what we're calling breakthrough COVID. And that's someone who has been vaccinated, double vaccinated, and now has tested positive. And, you know, luckily the majority of these people aren't getting sick. You know, they're getting mild symptoms, which is great, probably a testament to how effective these vaccines are. But then, you know, we sit back and we reflect, you know, did I actually hang out with this person? Was I in close proximity to them? Did I have contact? So how can we define contact with someone who has tested positive for COVID-19? What does contact actually mean?
That's a really great question. So the definition of contact is defined as being within 6 feet of someone for a total of 15 minutes or more over a 24-hour period. And this is regardless of mask use.
And, you know, I get nervous these days, you know, obviously back in April and May of last year, if someone sneezed in the bus, you're like COVID-19. If you got a fever, you're like COVID-19. And some of that PTSD, I want to call it, has still not gone away. My son had a runny nose the other day. My daughter woke up yesterday. She's like, "Yeah, Daddy, my throat is kind of sore." We get concerned, and we're like, if there was no COVID, we'd be like, "Don't worry about it. This is a common cold." But what if one of our kids gets the sniffles, or what are some of the hallmark symptoms of COVID in kids?
That's a great question. So we've encountered this scenario so many times in the last 18 months, really. You're exactly right. What used to be pre-pandemic, a pretty run-of-the-mill, cough, runny nose, you wake up, send your kid to school. Now that has many parents, daycare providers, and teachers worried, and unfortunately can also be really disruptive to the family schedule. So the symptoms of COVID in children can range from non-existent to very mild. So we've seen children with the mild sniffles, quote unquote, including runny nose or congestion. And they can go to more severe symptoms, including fever, cough, sore throat, the loss of smell like adults, fatigue, shortness of breath, vomiting, diarrhea, abdominal pain. That covers a lot of the symptoms that we see. So I would say that unless your child has been in quarantine from the outside world for more than 14 days, there's a possibility that those sniffles are caused by a COVID-19 infection. And unfortunately, in this case, the first step you would do is keep your child home from school, home from camp, home from daycare, from play dates, etc. And just as much as possible, try to isolate this child from the rest of the family. Now, I know that's not always easy if you have a 2-year-old, but as much as possible. And then next, you should make an appointment with the pediatrician. In this day and age, probably a video visit is safer than anything unless your child has severe symptoms or, worrying symptoms. And then the third step would be getting COVID tested. Now, if your child is above the age of 2, and we'll talk about this later, I would encourage them to wear a mask at home until you get a negative test back.
So even in my personal situation, and I'm going to lean on you as a physician and get free healthcare advice. So my son is almost 2. He's 20 months. Runny nose, no symptoms. No fatigue, eating well, normal behaving, no cough. I can't tell. He can't complain of the other things that you mentioned, loss of smell. I'm assuming he could smell something. At what point should I be concerned? I mean, he's fine. It's been 1 or 2 days of runny nose. And should I be quarantining him? Should I keep him from school?
If he's been exposed to anyone, if he goes to daycare, there's really no way for us to know if he has COVID without a test. I mean, granted, we are seeing a lot of kids with different viruses, not COVID, like RSV, adenovirus, all the viruses that caused your common cold. This summer has been a little bit strange in that way. So yes, it's 99% of the chances are that it's probably something like that he picked up at daycare. But it's really impossible to tell.
So let's talk about the scenario where a child has come into contact with someone who's tested positive for coronavirus, or even the worst case scenario where after all this, the child actually tests positive for coronavirus. What are some of those steps that parents should be taking in that situation?
So if a child comes into contact with someone who's infected with COVID-19, what the parent should do actually depends on the child's immunization status and the infection status of the child. So I'll explain a little bit better. The guidelines here actually were really recently updated by the CDC. However, parents must keep in mind that each state's Department of Health and each school system may have its own guidelines for testing and quarantining, which can be super confusing. So back to the CDC guidelines. If the child or adolescent is not fully immunized, that means it has not been at least 2 weeks since the final dose of the vaccine, then that child should be tested immediately for COVID. And if the initial test is negative, then test it again 3 to 5 days after exposure. So those guidelines are relatively new. After they're identified as having symptoms, quarantine for 14 days is actually recommended.
So even if that second test, 3 to 5 days after exposure, is negative, we're still quarantining, or at that point we can say you're free to roam around the country?
So the CDC does have some guidelines to shorten the quarantine, as long as you know to monitor for symptoms for all 14 days. So there are guidelines, I think, to shorten to 7 days if the test at 5 days is negative, and then you can actually shorten to 10 days if you prefer not to test. So they give you those options.
Okay. Well, now, what about the child who is 12 years old, who hopefully in this day and age has gotten the vaccine?
Good news there is that adolescents and young adults who are fully vaccinated don't need to quarantine after contact with someone who has COVID-19, unless that child or adolescent has symptoms. However, they should still get tested 3 to 5 days after their exposure. And even if they don't have symptoms, they should wear a mask indoors or in public places for 14 days following their exposure or until the test is negative.
It's daunting and stressful to think, at any point your child could contract COVID. Luckily, most of the kids who end up testing positive for COVID do well, but obviously there's a subset of patients who do not do well. What is a parent to do other than probably feel guilty when their child tests positive for COVID? What are they supposed to do at that point?
Unfortunately, we have been seeing rates of COVID infection going up slightly in children, so I really empathize with parents and their caretakers. I'm sure parents will feel a lot of anxiety about the effects of the infection on their child. And like you said, they may feel incredible guilt about how the child became infected. Like, should I have gone to that party last night? Did I bring this home to my child? On top of that, the parents are going to be stressed because they're going to juggle the responsibilities of work, family obligations, and they are going to have to find a way to isolate with the child for 10 days. Regardless of the stress, I really do implore parents to not send their infected child to school or camp or play groups where they might infect other children, and worse, these children's household members. So if the child tests positive, the same steps that you would take if the child is symptomatic, basically you would isolate the child at home for 10 days and then have everyone over the age of 2 years wear a mask at home. And that's really to prevent infection of other household members if possible. Then you would alert everyone that the child has been in contact with around the time they tested positive. And then the third step would be to arrange for all the household members to be tested and then quarantined if needed.
We've seen in the news and read with some of the data that for the most part, which is a blessing, most of the children who've tested positive for COVID-19 have done pretty well. What have you seen in your clinic? What have you seen? We're at the epicenter of COVID here in America, right? New York City at Weill Cornell, New York Presbyterian. We treated so many patients throughout the last year. What have you seen in terms of children recovering from COVID and getting through it?
Yes, fortunately, most children who have COVID-19 infections do really well. They only have mild symptoms that can be treated at home, like a fever, sniffles for a couple of days. That being said, a small number of children, and we have seen this, develop severe disease, especially if they have underlying health conditions such as asthma, diabetes, or obesity, or they're immune compromised. And then some children, a few weeks after the actual COVID-19 infection, go on to develop something called MIS-C. Many parents, I think, have heard of this, multi-system inflammatory syndrome in children. Now, this is pretty severe, and there's really no way for us to tell which children who get COVID-19 infection will go on to develop MIS-C. And then some children who don't develop MIS-C, but like adults, they might actually develop long-haul symptoms of COVID, so long-haul neurologic, physical, cardiac, pulmonary effects of the infection. So I would say if your child is infected and was sick enough or is sick enough to be hospitalized or admitted to the ICU, or if your child is a serious athlete, you really should work with your pediatrician and or cardiologist to determine when it's safe to return to routine activities.
For one of the children, again, less than 12, who has not been vaccinated, who tests positive, will follow the same protocols that you mentioned, quarantining, supportive support, things like that, hydration, etc. At what point or what symptoms develop where the parent or caretaker says, you know what, I think we should speak with a pediatrician or go to the emergency department? What may that look like?
That may look like a child who is starting to breathe faster, so is working harder to breathe. Anyone who has a fever that goes on for more than 4 to 5 days, I would definitely go and see the pediatrician, see if there's an overlying kind of other type of infection or pneumonia causing the fever. If they develop any other symptoms of MIS-C, such as red eyes, peeling of the skin, a generalized rash, severe abdominal pain, I would contact the pediatrician.
Appreciate that. You mentioned the best way, to our knowledge still, to prevent COVID in children is for everyone else to get vaccinated. So where are we? What's the current state of clinical trials in children in testing some of these vaccines? Do you think, or can you hypothesize, is there going to be an emergency use authorization for the vaccine in children? What does that horizon look like?
We're getting there. In March of this year, Pfizer, BioNTech, they started clinical trials of the vaccine in children 6 months to 11 years of age. So in September, which I think we're coming up September around the corner, there will be 6 months of data for the FDA to review. And if they agree, then I think the FDA will do an emergency use authorization later in the fall. And then the plan is for Pfizer to submit for the 6 month to 5-year-olds a little bit after that.
I don't know if you've been privy to or seen the data. Are you pretty optimistic that that's going to happen for our 6-month-old group?
I'm not sure about the 6-month-old group. I think it'll be easier for us to get authorization for the 5 to 11-year-olds first.
I mean, that'll help, right? Because most of our school children are that age. Not excluding the daycare kids, of course, but if we can get 5-year-old, I'll feel better. I have a 5-year-old daughter, so that will certainly make me happier if that's possible. But you think that might happen, in the fall, towards the end of the year? Great to hear.
And we can't wait. We're really, really anxiously awaiting that.
That brings me to another topic that we've talked a lot about on this podcast, and that's of healthcare disparities. And, I think this COVID-19 pandemic has certainly highlighted the racial disparities in healthcare in this country. And, we know that Black and Hispanic population adults have higher rates of hospitalizations due to COVID. Yet this is the group that's still very hesitant to get the vaccine. And just to give you some statistics, in New York, 17% of eligible Black and Hispanic patients have received both vaccines, 17%, compared to 74% of white and non-Hispanic counterparts. So how important is vaccination in these underrepresented minority kids, especially the 12-year-olds and above who are actually eligible for the vaccine?
Well, like you just mentioned, Black and Hispanic adults have higher rates of hospitalization. They also have increased risk of severe illness. And Black and Hispanic adults have higher rates of COVID-19 related deaths compared to the white counterparts. And while thankfully deaths due to COVID-19 among children and young adults are rare, the CDC actually just released some data on this. So through the first 6 months of the pandemic, children and young adults under 21 years of age, they found that deaths occurred predominantly among older adolescents, males, Black and Hispanic children and adolescents, and children with underlying medical conditions. So we know that COVID-19 vaccines are safe, and we know they work, and we know they reduce severe disease, hospitalization, and death. And we also know that Black and Hispanic people have received smaller shares of vaccines compared to their shares of cases and compared to the shares of the total population. So yes, it's really, really important because Black and Hispanic children will be more likely to be around unvaccinated adults. It's really important for them to get vaccinated, especially if they're age 12 and above now, and then when we get the authorization for the younger children. And it's also important for us to continue to understand and address the causes of these health and vaccine uptake disparities.
I completely agree with you, and a part of this is hopefully what we're trying to accomplish, which is educating the listeners out there. Another statistic I recently heard was in New York City specifically, African-American males aged 18 to 44 are receiving the vaccine at a rate of about 10%. I mean, that is an incredible statistic. And 90% of these individuals are saying to themselves, I'm youngish, I'm healthy, I have no medical problems, I'm going to take my chances. I'm going to fight this disease. If I get it, most of my friends have gotten it, they do fine. What do you say to those group of patients?
That's actually a lower number than I read, so that's really surprising. I would say that COVID-19, there's no telling who can get severe disease and who gets long-haul symptoms. And if you are one of these unlucky people who does get the infection and does get very, very sick, it could have just been prevented with a vaccine. And millions of people have gotten this vaccine. It's safe. And I would really try to understand what their concerns are, but I'd really just kind of point to all the statistics. Sometimes that helps. Maybe there are cultural concerns also, and maybe the family doesn't want the vaccine, but I think they have to think about, who in their lives would be affected if they were to be hospitalized or if they were to be in the ICU.
I totally agree with you. I think sticking with the science and sticking with the data is probably the best way we have to move that needle on achieving better vaccination rates in this group of patients. One of the concerns and something that's my patients have brought up, especially in their children who are age 12 and above eligible for the vaccine, is What about their kids who have allergies, who are anaphylactic to things? Like my children are pretty anaphylactic to certain types of nuts. And not that I'm going to hesitate when they get a chance to get the vaccine, but that might come up. What about these patients who have a history of anaphylaxis and are allergic? Have you read or heard anything about their ability to get the vaccine?
So for adults, I know the risk of anaphylaxis to the vaccine is actually quite rare. It's quite low. I have not seen the data in children, but I imagine it would be similar. The vaccines are administered in a controlled environment. In our clinic, we have emergency medications available, and we do, you're supposed to be monitored after you get the vaccine for at least 15 minutes. And during that 15-minute time, that's the highest risk of anaphylaxis.
So presumably if there was a response, they'd be in a controlled, monitored environment to allay some of those anxieties in the parents who are on the fence. So you've heard it here first, folks. Even in anaphylactic, both adults and kids, probably safe to get the vaccine. And even though it may pose a risk, you're in a controlled environment. So.
Right, and I would add it's still a very rare reaction.
Going back to school, New York City, we're starting school here on September 13th. My daughter is entering kindergarten. We're very, very excited for her. But we have concerns. We're stressed that, COVID-19 is still around and the Delta variant is burning through our community. What are some of the things that children might be anxious about in going back to school?
They've been home for so many months. They've seen a lot of images on TV. So maybe they think if they get back to school, they'll get scared of getting sick or bringing the virus home to family members. They might have trouble separating from a parent that they've been at home with so long. They might be scared of even leaving a newly adopted family pet, our pandemic pets that we've all adopted at home. They may also be very concerned about racially targeted violence when they leave the home. Like your daughter and my niece, only had 6 months of actually in-person school before the pandemic started. Now she's supposed to be entering first grade. For those who are entering high school or a new junior high school, it's a brand new school. It's a brand new school year, and it's kind of like an extended summer, and then you're supposed to be going to school. So I think they'd be scared about, if they will have friends when they get to school, if they will know actually where their classes are, if they even know where their school is. So I think some of them might have those concerns. Some children with developmental disabilities or maybe social anxiety, depression, some of them did actually really well with virtual learning, and they might be very concerned about going back to school because of what's required of them in the classroom.
How can parents identify and how can they tell if a child is anxious about going back to school? Some kids are great communicators and some may not be. So what are some signs and symptoms that a parent can pick up on?
Yeah, I think parents should really just kind of watch their child as they talk about going back to school. Some younger children, they might become more defiant or irritable or maybe clingy as you discuss school. They actually might just refuse to go. Actually, some of them express their anxiety just by seeking frequent reassurance. So they'll ask you many times, am I going to get sick? Are we going to be all right? Is grandma going to be all right? Is the dog going to be all right? And, they're not really seeking an answer from you. They're just expressing their anxiety that way. Some kids might have trouble sleeping, or they might have lack of appetite or lose concentration. Some teenagers, they'll spend even more time in the rooms, be even more withdrawn than they are, and that's kind of a sign for parents to look out for. And then some might have like physical symptoms like nausea, dizziness, headaches, stomach aches, especially when it comes time to start school.
We believe and think that, returning to in-person schooling promises a more stable, interactive learning environment. It's probably good for social development. But like you mentioned, it probably could present new mental health challenges. So what can parents do? You mentioned how to identify some of these behavioral changes, but what can they do if a child is, fearful to returning to the in-person environment?
So this is such a great question and so important. So I would encourage parents to ask their child what's on their mind and really listen intently. So parents should start with open-ended questions and then maybe dig a little bit deeper. An example of this is ask them how they're feeling about the past year, what went well, and how they're feeling about going back to school and what are they most excited about. And really, parents should avoid asking leading questions such as, are you nervous or scared about going back to school? That kind of puts it in their mind. And then make these conversations casual, maybe during dinner time or a walk or a drive, but they should be ongoing. And, it's not one and done kind of conversation, so that the child has time to process their thoughts. And for teens also, it might help to just schedule time with them. So once a week, just kind of sit down with them and talk about what's needed, and what they're feeling.
A lot of myths are out there in the media and that we see on TV regarding children going back to school, specifically some of the mitigation strategies that we want them to practice. Obviously, social distancing and hand washing are, kind of easy, but it's this concept of wearing masks. And there's people out there saying, when a kid wears a mask, there is an increased risk of developing depression. And I've seen this on a number of different news media outlets, and I'm wondering, is there any truth behind this statement of depression and mask wearing?
So this is a really interesting question, Dr. Singh, and I think I can try to address it by breaking down the main concerns, or the main myths or misinformation out there about children and mask wearing. So I did a little bit of digging, and I saw, what parents are writing out there. So the first question I think I want to address is, does wearing a mask cause depression? And I can tell you that there's no evidence that mask wearing causes depression. The sad thing is, by April of this year, almost 120,000 U.S. children have lost a parent or a grandparent to COVID-19. And then many more have witnessed their family members become hospitalized, become disabled, and then many more than that live with housing or food insecurity that's exacerbated by the pandemic. So we've had a very traumatizing 18 months, full of images and videos in the media about racially targeted violence, politically charged violence, natural disasters, suffering due to the pandemic in our country and across the world. And then children and teens, they've been isolated from their friends, families, teachers, community leaders, and other supports that make a huge difference in their lives. So these are most likely the reasons that rates of mental health issues and depression in children are increasing, not mask wearing. Now, the second question, when I started looking at this, that I've seen is, does mask wearing and being around other masked children and teachers affect learning and cause social developmental milestone delays? So I've seen that question out and about. So it is true that learning to interpret facial expressions is really important in the development of social communication skills in children. But communication is so much more than just, what you do with your mouth. So expressions of the eyes, body language, and verbal cues, these are all things that children will rely on if you're wearing a mask. And then children who are learning these skills, they're exposed to their parents at home who aren't wearing masks. And that's really enough to avoid any delays in their milestones.
I want to talk about something a little controversial. And, you've shared so many good tips already on how to identify maybe some anxiety and maybe depression regarding going back to school. But you gave the statistic. You said 4.3 million children have tested positive for COVID in the United States. And about 15% of the new cases are children anyway. Yet the hospitalization rate is quite low, 3%. The death rate is pretty low, 0.2% at the highest levels. So to play devil's advocate here, someone on the other side says, you know what, we don't need vaccines. Kids do fine. Why am I going to vaccinate my 12-year-old, or even when it's a 5 to 12-year-old when it's eligible? We don't need to do it because kids do fine. It's almost like getting the flu. How do you respond to that? And is that true? Are the rates of death and infection similar to the flu, or is that misquoted?
I don't know the numbers off the top of my head, unfortunately, but I would say that, yes, it can be a very mild infection in children. But there's really no way to predict if it can be very serious. That's one thing. Children, the risks are low, but they have died. They have been hospitalized. And the second thing is, if your child is not vaccinated and you have elderly, susceptible adults at home, they will get sick if your child brings that infection home. That's the kind of the biggest thing also, that, you will lose caretakers of that child. And we know that males, obese, older adults are more susceptible to severe illness.
I think that goes back to our responsibility as a community is to protect one another. And, when we were all getting the vaccines at the beginning of this year and December last year, we were kind of putting it on our social medias. I got it for you. I'm a relatively young, healthy male. I probably, knock on wood, could be okay if I got the virus, but I did it for you. I did it for my parents. I did it for my family. I did it for my community members. So just like you said, I think it's important to protect one another. And that's really the value add of the vaccine in this population, also to prevent severe illness. You mentioned something else also about how some of these risk mitigation strategies are dependent on your locale, your district, where you go to school. So I want to ask you kind of a philosophical question. What do you think the role of government should be versus individual school districts in these mask mandates? There's a lot of governors that have banned the mask mandate. Some schools are saying, do what you want. I know it's a tough question to ask, but you're the expert. You're the healthcare professional. I want to ask what your opinion was.
Sure, thank you. So I think that any COVID-19 related policies or mask mandates, first and foremost, should be science and data-based, not politically based, and should prioritize the health and safety of our youth and their families. So children under age 12, many over the age of 12 across the country are not vaccinated. They're unprotected against the serious risks of COVID-19. They're living in communities of unvaccinated adults. So I think to reduce conflicting advice, ambiguity, proliferation of misinformation, mask mandates, and school safety measures should come from a central, reliable source, such as the CDC.
There you have it. Science first, partisanship second, or none at all, to be honest. Just a last question. Overall, just share with our listeners, when should they be thinking about seeing you, their healthcare provider or a mental health provider for their kids who might be anxious or worried about going back to school? Well, what are some red flags that they could identify?
For children who are not yet verbal, sometimes you'll have younger kids who are very anxious. You're going to see, if you see like increasing defiance or irritability and continuous refusal to go to school for more than 3 to 4 weeks after school starts, I think that would be a red flag. And of course, any changes in appetite that are unexplained, changes in weight, for any changes in sleep, so like reversal of sleep patterns or a teenager who's just not getting any sleep, that will trigger you to think that maybe something's going on. And of course, any thoughts of and expressions of suicide or self-harm. For college-age students, maybe a drop in their grades might kind of trigger you to get some mental health specialists involved.
Every parent here or everyone with nieces and nephews wants what's best for their children, but in the age of the internet and social media and, different news media outlets, it can be difficult to navigate what's actually fact-based and science-based and what's pure speculation or myth. So we're very, very lucky and very fortunate to have you, Dr. Sherry Wong, on the show today to share your expertise. And thank you out there to the listeners for tuning in to the Backstory podcast, where we attempt our best to deliver evidence-based, high-quality information to optimize your health and recovery. So remember, when it comes to your health, when it comes to your safety, we here at The Backstory, we've got your back. Thank you, Dr. Wong.
Thank you.
Thanks for listening to The Backstory. Please subscribe, rate the podcast, and review The Backstory on Apple Podcasts, Spotify, and Google Play Music. And feel free to share this podcast on social media or even your own website or blog. This podcast is for general information purposes only. It does not constitute the practice of medicine, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for medical advice. To learn more about Dr. Singh and his clinical research, please follow him on social media. You can also sign up for his newsletter by going to www.rickysinghmd.com. That's RICKYSINGHMD.com.